OT life hacker here. Oh my goodness, I am so full of energy from field work and I can't get over how much I absolutely love it. So I am out for a walk to try to burn some of that energy and maybe even take you guys running with me. Yeah. No, that probably would be a little too irritating for you, right? So we won't do that. Oh my gosh, guys. Okay, so this video is going to be about, for those of you in occupational therapy or going into occupational therapy, what might you want to focus on, or where would you want to go in the field of occupational therapy? So I'm going to share on acute care so that you get some idea of what acute care is like and if you'd want to go into that. So acute care always keeps you on your feet. As you can see here as I'm walking, you're constantly on your feet and you're going up and down the stairs, up and down the halls, getting lost, still getting lost here, guys. I am the queen of that. But it's awesome because you're always going to different areas. You likely in your acute care setting won't be going to the emergency department, but in our hospital we did, and we do sometimes go there, and we did today. Gosh, there's always something so different. You never ever can predict how something's gonna happen because anything can happen. The status of the person may change. The person may be discharged without you even knowing until later on, and the doctor's orders might be different. The patient, they might be going to a different setting, so you have to adjust your time frame of working with them and all of that. There's so many things to consider, absolutely a ton of stuff. And the patient status, because acute care means, so they're in the hospital and they're receiving care for something acute like a stroke, a fall, trauma, so they maybe like a gunshot wound or I'm thinking of all the things that happened today. There's so much action today. A lot of motor vehicle accidents. So guys, please be careful when driving. There were motor vehicle accidents and a person people who had gotten hit by a car, motorcyclists getting hit, bicyclists getting hit, and really bad injuries. So be very careful. Acute care also teaches me for my own self on how to really prevent things from happening, because a lot of problems that come in are things that could be prevented potentially. So it does teach me a lot about my own health and how I need to take care of myself in this area, how to take care of myself, and all of that. And so there's a lot of practicality in working in the hospital for your own sake of mind and your own health. Oh my gosh, there's so much. Where else do I go with this? Check out the park. Look, isn't that gorgeous? See? Oh, the wind in my hair. Oh, yes. So you're going to be working with a lot of different staff. So you'll be working with case managers, the doctors, the nurses, nurse practitioners, physician assistants, and physical therapy, speech therapy, and everyone else who's a part of the team for this person. And so there's a lot of communication. You'll be on the phone a lot, and you'll be checking around the floors to see where the nurse is at or where whoever you're looking for is at. And you'll have to check the boards to see where the numbers are. So there's a lot of different places that you have to go to get information in the charts and on the floor itself. And so there's a lot of problem solving and creativity. You may not have what you need in the room, so you have to change up the plans. And also the patient, again, it may not be as you had intended them to be. Say for example, them getting up, what if you don't expect them to all of a sudden have nausea? They may have nausea, and so how do you respond to that? So you have to be quick on your feet, literally quick on your feet. Run and get that bucket or whatever is in the room that you can use. And you have to think about what their home is like, because you want to set up the environment as close to their home environment if they are being transferred home. If they're being transferred to acute care or to acute rehab or inpatient or skilled nursing, then those are other considerations for you to keep in mind where you might be transferring them, because your goals are going to be based on that. Oh man, guys, being totally raw, people always ask me at the workplace how it's going, which I don't quite understand, because can't you see I'm a ball of like excitement over all this? And they do know, but I think I scare them when I'm like, I love it, I love it. I'm about to pounce on them to tell them how much I love it. So for you guys, if you like fast pace, this might be a good route. If you like fast pace, a lot of problem solving, creativity, you will be using these skills in all settings, no doubt. But in this setting, you don't have much, whatever resources are available in the room, and at that moment, if something happens, you have to know how to respond to it quickly, because these are complex cases, complex conditions. Everyone usually will have more than one problem. And when you go in, you might be treating the problem that's not even the one they intended for. They may have pain in somewhere else that's causing their problems with functioning. And you do have to use a lot of different forms of communication and be understanding of the level they're at currently, because they're in a completely different setting from their home, and so you have to be cognizant and empathetic towards that as well. And you'll be working with a lot of different people, as I said, who have very different personalities, and how do you work with all those different personalities, not just with the patients, but with the faculty, staff as well. And the caseload so far that we've been having is for 10 hours. It's been 9 to 10 patients, but that is to go up. I think the typical is 13 patients for 10 hours a day. I love it, guys. All right, I will talk to you later. Bye-bye.